So the first question we already answered it. Initial test for primary adrenal in primary or secondary for adrenal insufficiency. Initial test is serum ACTH and cortisol measurement. You start by reading the question. What is the likely diagnosis? First, start reading by question. If you are appearing for step 1, you can do this thing, that read the last question first and then try to get the answer directly, because in step 1 they generally ask you about the diagnosis, or they generally ask you about the what is the underlying pathology, and that can be guessed based on the last one or two sentences, but it will not work in step 2. In step 2 you have to read the whole stem from the start to finish. There is no other way. And even if you start the question first, most of the time the question will be, what is the next best step in management? So right now let's see the question. What is the most likely diagnosis? We have a 42-year-old woman who is coming to the office with 3-week history of fatigue history and nausea and lethargy. She was diagnosed with sarcoidosis 9 years ago, which is being treated with prednisolone ever since. Temperature is normal, pulse is normal, blood pressure is low, blood pressure is a little low. Respirations are 16. On physical examination, abdomen is soft, non-tender, bowels are present. Menstruation occurs every 28 days, last 5 weeks. CNS examination shows weakness in proximal muscle bilaterally. Remainder of the examination shows no abnormalities. And after obtaining early morning serum ACTH and cortisol levels, both were found to be low. But 1 hour after co-entropin stimulation, her cortisol increases. It does not increase to normal levels, so it just increases. What is the likely diagnosis? Now, you have a couple of clues which tell you that it is not the primary adrenal insufficiency. And the largest clue in that regard is this. Early morning ACTH and cortisol levels were found to be low. So if ACTH level is low itself, it cannot be primary. It has to be secondary or tertiary. So we know that it is either primary, it is either secondary or it is tertiary. We can rule out the primary adrenal insufficiency guaranteed. So let's look at the option. Autoimmune destruction of the bilateral adrenal glands. This is primary. So this one is gone. Next, secondary infiltration of the anterior pituitary. This could be the answer. Disruption of the HPA axis. This could be the answer. So let's see the next option. Ischemia of the pituitary gland. That would make it secondary. So this could very well be the answer. Tuberculosis of the adrenal glands. This is primary. So we've ruled out 2 options. We are left with 3 options. This patient was diagnosed with sarcoidosis. So sarcoidosis could be the answer. This patient is taking prednisone from a long time, and this patient is also showing weakness in proximal muscles, which happens because of steroids. So disruption of HPA axis could also be the answer. Ischemia of pituitary gland. Now, ischemia of the pituitary gland, what does that require? What do you need? What is the basic requirement if you want to do an ischemia of pituitary gland? You either need to have very severe hypotension or very severe hemorrhage elsewhere in the body, motor vehicle collision, or you need to have something like a pregnancy scenario, that the patient is a postpartum multigravida with a lot of bleeding and blood transfusions, or you have to have a history of pituitary adenoma. Only in that case, hemorrhage of pituitary gland is possible. So there is no history that is suggestive anything of that. So we are excluding this based on history alone. This is what you have to do if you want to get your questions right in step 2. You have to see, like, this could very well be the answer. This fits perfectly, but it is not. Why? Because circumstances do not allow it. Circumstances are the key for step 2. You have to look at what the circumstances are, and what circumstances the patient is presenting. Your diagnosis, your answer will be according to the circumstances. So this is why this is not the answer. These could be the answer. Now, how else can we narrow down one more option? We have 2 options in front of us. This one does not clearly fit. So we've ruled this one out. These two are clearly incorrect. Now we are left with two options, two very confusing options, two very similar, very close options. But trust me, this is what you will see on your step two. Two options very close, cannot differentiate at all. So this is the point where you have to start reading the question again. When you are stuck at two options, start reading the question again. When you read the question multiple times, at least two or three times, something else will go on in your mind, especially after you come back to this question after doing every single other question of the block. So let's just say you did this question, you got stuck at these two options, right? You were stuck between B and C. You cannot for the life decide what is the right answer. Your brain is not working. What you should do is leave this question right now, go do all the other questions, finish every single other question, then come back to this question and start reading it from the stem itself. Do not just read the options, read the stem as well. So let's read the stem again. 42-year-old woman, 3-week history of fatigue, nausea, lethargy, diagnosed with sarcoidosis 9 years ago, treated with prednisolone ever since, temperature normal, pulse normal, BP a little low, respirations normal, abdomen soft, non-tender, bowel sounds present. Menstruation occurs 28 days and lasts 28 days, occurs every 28 days and lasts 5 days. And CNS examination is showing weakness in proximal muscles. So, there is one line here about menstruation. What would happen to menstruation if anterior pituitary gland was infiltrated by sarcoidosis or by hemochromatosis or by anything else that is infiltrative? It could be amyloidosis, it could be Wilson's disease, it could be any infiltrative disease. What will happen if there is an infiltrative disease of a pituitary gland, anterior pituitary gland? What does the anterior pituitary release? There are two divisions, right? Anterior pituitary, posterior pituitary. Posterior will release oxytocin and vasopressin. Anterior pituitary will release every single thing, everything else apart from these two. So it will be releasing ACTH, LH, and FSH. It will also be releasing TSH. So if there is an infiltrating disease of the anterior pituitary gland, then not just the ACTH, but additionally TSH and LH and FSH will also be reduced. I told you that remainder of the examination shows no abnormalities. There is only isolated problem in ACTH and cortisol levels. There is no other problem in TSH. There is no other problem in FSH, LH. There is no other problem in menstruation. Now do you understand the importance of this single line, that remainder of the examination is normal? But for that you have to have this idea that if anterior pituitary is affected, then all the hormones are affected. But there is something else that is affecting the HPA axis specifically, and that is the steroids that the patient is taking. The steroid is what it is causing problem, not the secondary infiltration. So that is how you differentiate between the options. Now you need to have the fundamentals. I told you initially that you need to have base knowledge about everything else. We had base knowledge about options, we had base knowledge about exclusion criteria as well. How do you differentiate? That comes on characteristic and clutch worthy information and thinking the examiner's way. Like you see, you had knowledge, but still it was not that much helpful. Just because of one little clue, you got stuck. But if you have that one little clue, then you can get the answer. I don't want you to give the clue. I want you to start thinking in this way. So that next time you read this sentence, the next time you read a normal finding, you will think that in order to make this option correct, I need to have problems in thyroid, I need to have problems in menstruation. If there are no such problems, then it is an isolated issue, so it should be something else. I hope you guys understand. This is the kind of thinking you have to develop if you want to score really well in step 2. Now let's move on to our last question. This you should be able to solve, because up until now, throughout these two questions, we've established that it is an secondary or tertiary adrenal insufficiency. We have gone through how the primary manifests, how the secondary is different from the primary. So based on that information, I believe you should be able to answer the question. And in order to answer that question, you have to start going through potassium. So start going through potassium. Potassium is normal, bicarbonate is normal, sodium is decreased, glucose is decreased. Yes, this is the answer. This is how the secondary adrenal insufficiency will present. Why is that? Because first, mineralocorticoid is preserved, so there should be no issue in potassium, there should be no issue in bicarbonate. Cortisol, the glucocorticoids are low, so it will cause low amount of glucose. So you guys all answered right. Now, if it was primary adrenal insufficiency, what would happen in that case? In that case, it will be option A, right? If you like today's session, if you liked my teaching method, and if you want to study with me, I'll be happy to teach you, and I'll be happy to tell you every single thing, what I did, why I did, and how you can do what you need to do in order to get a good score. With that, we will conclude today's session. I hope everyone had a good time and you guys learned a lot.